I'm Dr. Tom Daniel. I'm the course director of this General and Thoracic Simulation Surgery course. I welcome you on behalf of myself and my faculty. The purpose of this site is to allow surgical residents and faculty in the developing world to practice commonly encountered operations in general and thoracic surgery. During this course, learners will progress through online lessons and complete review questions after finishing each lesson. After completing all of the lessons, learners will be presented with a certification quiz that presents the same questions in a randomized fashion. A score of at least 80% is required to pass the quiz. Learners will have access to a pre-certification document that they can print upon successful completion. Satisfactory completion of the online certification quiz will be followed by participation in the simulation surgery workshop. Upon successfully completing both the online and in-person components, the instructor will approve the learner and they will have access to a completion certificate. Thank you and enjoy the experience.
And put them here. So now we're back to this. That's what precedes. Now, this is just a sheet. When you turn a patient, you don't want to have them lying on their arms, so you bring this out. And you bring this out. Good morning. All right. Now, when you turn, I want everybody to participate. Monty saw this yesterday, so he's my right-hand man. So, Monty, if you would handle the hips and the legs, all right, we will turn that. So, then you pick up on the draw sheet. Anesthesia will be in charge of the neck so the neck doesn't bend. All right. You, ladies, you'll help with that. Arms. Make sure we don't lie on the arms. And we will turn this side up. We want to go to the right side. So 1, 2, 3. See, everybody has this teamwork. And you get just where you want to be. And then you tuck that. Okay. And Monty, you do the tying here. Show them how to do this. Tuck this in, tight. Monty will. He's going to put a bow in there because you're going to release it at the end of the surgery, so you're not going to lie. Now, there are many ways to do this. This is the University of Virginia. But I wanted a way that was inexpensive, doesn't require special equipment. And this works beautifully. You may have seen my talk PowerPoint a week and a half ago. Yes. I showed a picture of Alex Williams. He was the operating room attendant who taught me how to do this. So I had to go back and learn it. And now that you've got this done, and this arm should be free. Where's that right arm? Okay. One thing to remember when you put these rolls in, if you put them too high, then the arm has to go here, and that stretches the brachial plexus. So little surgeries like that, you put this here and this here. And during the case, you as the surgeon will always be pushing this way, and anesthesia will push you back down. Because they're protecting the patient's arm. So exactly. And they're going to make sure you don't do that. Yes. So using it as an arm board, we put here, padding. And then there sometimes is a special table that you can take this arm and put on. Yes. And if you do that, you need to have a little cushioning to protect the ulnar nerve. Yes. So that's, and anesthesia will take this and take this. So that adds a little more security. That's pretty stable. But now we've got to deal with the legs. And somebody's already slipped this up. You did that, didn't you? He learned. You was yeah. Okay. Show them what you did. Why we did it. Right now, these are sort of stable, unstable, like this. So show Armani what you did.
This was unstable, then I put this one like that. Then to prevent pressure psoas.
Okay. So that's the lower leg is the one that offers the stability. You can bend this one, but it's real high, doesn't it? So, and now I've used pillows I brought from home, from store at home. But folded blankets would be just as well. Just, the principle is cushion the bone so you don't get a pressure sore. Now this is nice, but it's still unstable. So we go one step further. This is not adhesive tape, but in the operating room you would use adhesive tape. This is just less expensive. I brought this over to simulate these. So, now if you would take this and attach it, hold on to this, pull this up and attach it underneath this is operating table. And let's get a little cushion. All right, over the knee. And we stand over here. Hold that up for me. Okay. That's a little more stable, but we want to stabilize the hip. So we do the same principle. In the University of Virginia, we take a folded blanket, cushioning the spine, the issue, and then we do the same thing over here. Push it up and push it. Okay, now, we've got a pretty stable situation. You would then take probably a quarter pad and bring it over here. And the one remaining thing we can't do on this the second table, but in the operating room, most operating tables, you can break the table.